Chiropractors aren't real docs. Here's another example of why I'm proud for people to think I'm not a real doc based on what the real doctors are doing for pain. Let's take a look at the article from the Wall Street Journal and gabapentin. And again, with Pfizer lying based on sales over patient care. So pain care in this country is absolutely broken. In the Wall Street Journal, they talk about a 33-year-old former high school physical education teacher described his original back pain as feeling like a paper cut compared to what happened next. Not from his injury, but from stopping a drug that he was prescribed and urged to take for pain. They didn't look at why he had pain, just here's another drug. When he discontinued gabapentin, he experienced severe, prolonged withdrawal with neurological symptoms that permanently altered his life. And here's the problem. Gabapentin is routinely prescribed for conditions it was never approved for. They're prescribing it for chronic pain, anxiety, migraines, insomnia, hot flashes, even altered smell. The practice is considered legal, but it also means that the FDA never fully evaluated the risks for those uses. So again, the real doctors, not the fake doctors, the chiropractors, as some people say, are prescribing a neurological central nervous system drug for off-label uses, which is totally real doctors. For years, gabapentin was promoted as safe, non-addictive, and even as a solution to reduce the opioid use. Because remember, the fake doctors, chiropractors for pain, never prescribed opioids. The real doctors did. But the science, according to the Wall Street Journal, tells a different story. A growing body of research shows that gabapentin is not as safe or effective as once believed by real doctors. I believe the chiropractic or the fake doctors never really subscribed to this because history and what we know about pain, and pain is usually, especially spine pain, due to abnormal structure and stability, not because you're lacking a drug in your body. But the real doctors believed it may have been safe and effective. It has been associated with increased risk of dementia, suicidal behavior, dangerous breathing suppression, especially in patients with lung disease and severe swelling. A recent study, according to the Wall Street Journal, found that giving gabapentin to surgery patients did not reduce complications, did not shorten hospital stays, and shockingly, really, who was shocked? More patients repeated pain 4 months later. That's not shocking to the fake doctors, the chiropractors, where you're not fixing the pain, you're giving a drug to cover it up. And then what happens if you ignore the real problem, the real spinal subluxations? The science shows it's going to get worse. So of course we're not surprised, but we're not real doctors. And despite years of claims that it isn't habit forming, patients report debilitating withdrawal symptoms when tapering off the drug, which is a clear signs of dependence while taking it exactly as prescribed. What's even more concerning, the CDC warns that combining gabapentin with opioids is potentially deadly. So let's take a look at what the federal and state data, according to the Wall Street Journal, shows that at least 5,000 people have died a year from gabapentin involved overdoses in each of the last 5 years. Gabapentin is now the most prescribed central nervous system drug in the country. Central nervous system is for the brain and spinal cord, but they're prescribing it for peripheral neuropathy. And one of the most frequently reported to the FDA causing adverse events. In 2025 alone, there were over 5,300 adverse events were reported, including a 21% increase in life-threatening complications compared to the year before. So 5,300 adverse events plus 5,000 deaths a year. And hospitalizations were on the rise due to the drug. And yet we're told that this is the best we can do. According to Wall Street Journal, one physician said, hey, we want to help patients in pain, and there aren't a lot of great options. So here's the question. You're saying there aren't a lot of good options for pain patients, but let's take a look. How about before prescribing powerful central nervous system drugs to mask the symptoms? How often are these doctors, these real doctors, referring to a fake doctor like a chiropractor? Because when we actually look at chiropractic outcomes, the story completely changes. Multiple surveys show that 77 to 96% of chiropractic patients report improvement in back or neck pain. One of the same reasons that patients are being prescribed this drug. A large outcome studies report over 90% positive results for spine pain. In a broader community sample, 96% of patients say they improved after chiropractic care. So again, that's not theory. This is patient experience. This was a very simple, quick internet search without even diving deep into the research, which I can easily do. Right? We can easily look into the research of that. So what about chiropractic safety? Well, they say we're not real docs and we're dangerous, but let's take a look, compare it to just gabapentin. The estimated risk of death from chiropractic neck adjustments is approximately 1 in 4 million, and a risk that's considered extremely low in healthcare. Serious adverse events are incredibly rare, especially when compared to prescription medications that affect the central nervous system. 5,000 people a year are dying from gabapentin. They show 1 in maybe 4 million might die from chiropractic, but those people may have already had an event before they saw the chiropractor. So let's take a look at what else the Wall Street Journal talked about with a 77-year-old woman who went to her doctor for worsening back pain, to the real doctor, not the chiropractor. She left with prescriptions for gabapentin and opioid, not a prescription for chiropractic to fix the abnormal mechanical structure, load, and function of her spine that is strongly related to pain. The next morning, her husband of 49 years found her dead. A toxicology review confirmed gabapentin played a very central role. She was already on 14 medications, mixing 14 medications from the real doctor for her pain, and the drug combination slowed her breathing until unfortunately she died. But this is not rare. This is not accidental. This is systemic. And if it can get worse, it actually does. The manufacturer of gabapentin, I believe it was Pfizer, aggressively expanded its market without seeking FDA approval. No way. A pharmaceutical company doing illegal stuff and telling us it's good for us? And the funding was bias studies and promoting off-label use. Internal documents revealed executives knew about serious risks: depression, suicidal thoughts, confusion, dizziness. In fact, in the court documents, one Pfizer medical director famously called it the snake oil of the 20th century. But the good news is for Pfizer, not for patients, sales exploded from under 100 million to over $2 billion. And these are being helped by the real doctors to give this type of treatment. Eventually, what did Pfizer do? Well, they do what Pfizer has done. They pleaded guilty to criminal wrongdoings and paid $430 million in fines for illegal promotion. But a $430 million fine with an increase of about $2 billion in sales, that's like big deal. That's like you stole as a kid 10 cookies from the cookie jar, and your punishment was you only had to put 2 of the 10 stolen cookies back. What kid is going to keep stealing from the cookie jar? It's about profits over sales, and the chiropractors are being touted as fake doctors. So the real question is this: why is this drug, first pain care, still the default by real doctors as opposed to referring to fake doctors that has an incredibly high satisfaction rate to patients? Well, chiropractic care addresses function, biomechanics, and cause, not chemical symptom suppression. It does not require dependence. It does not carry systemic toxicity. And patients overwhelmingly report meaningful improvement with chiropractic care. So, if we truly want to help patients in pain, maybe the first referral shouldn't be a prescription pad. Maybe it should be a chiropractor. So I'm Dr. Evan Katz Chiropractic in Boulder, Colorado. If you have questions, give us a call. If you want research on pain and how chiropractic can help, and why do you have pain? You don't have pain because you're lacking a prescription or an injection. Look, there's a time and a place for meds. I'm grateful that we have a time and a place for meds and surgery. It's sometimes needed. But 5,000 deaths a year, over 5,000 adverse reactions and increased hospitalization and dementia, maybe we can help by looking at why you have pain. So again, I'm now proud 2026. If I have to do this type of care with prescriptions and deaths to be considered a real doctor, by all means, call me a fake doctor. I'm embracing it this year. If a fake doctor is almost no deaths and an incredibly high satisfaction rate, that's what's considered um, a fake doctor by some, and helping why the patient actually has pain by reducing spinal subluxations and mechanics, cool. I'm totally happy with being considered a fake doc by some. Come on, let's change 2026. Let's change your health. Let's get after it. Thank you all so much.